technical assistant of the Presidential Advice on Mental Health. There you have it on your screen. We're talking about the mental health situation in Africa. So let's begin with South Africa. It indicates that about 75% of mentally ill South Africans have no access to psychiatric or therapeutic care. So that is what is happening in South Africa. 75% of them who are suffering from mental issues do not have a psychiatric care. And the National Health Insurance Program will not fully be implemented until the 2025. Sad situation right there. So now, in Nigeria, we have less 10% of mentally ill Nigerians who have access to a psychiatrist or health workers. That is better than South Africa. And Nigeria only has 130,000 psychiatrists for its 174 million people. So 30 for 174 million people. Daktari will be telling us whether that number is enough. Now, to Ghana. So Ghana passed its mental health law back in 2008. Does Kenya have one? How is it looking like? We'll have a look at that also. And Ghana has 3 psychiatric hospitals. What about Kenya? We'll also be looking at that. Now, in the common mental health, sorry for that, the triggers in Africa, you know what triggers mental health in Africa? We have conflict, unemployment, violent crime, genetic predispositions, and child trauma, including traumatic brain injury. So those are some of the things that trigger mental health issues here in Africa. And so let me bring in Dr. Priscilla Macau, Technical Assistant of the Presidential Advice of Mental Health. Daktari, thank you for joining us here on Bottomline Africa today. So we've had a look at this mental situation of countries within the African continent. What is your take on that, especially South Africa? 75% do not have a psychiatric sort of healthcare.
It is rather unfortunate that most, not only Africans, just most people in the world do not have proper access to mental health related places and services for healthcare, and it is a sad situation. Actually, it's sad even now when you come to low middle income areas, and Africa is one of them. So that's a really sad situation, and it just paints a grim picture on how mental health was viewed before, and now, thanks to the pandemic, we are now seeing the importance of having mental health.
I looked at South Africa having 75%. Ghana was looking a bit better.
Yes.
Just having 10%, of those who are not getting the help that they need, mental health. When you look at those two countries and you compare it with Kenya, how are we as a country?
I'd say, like with Nigeria, how they have 130 psychiatrists for 174 million people. I'd say maybe we're doing a much better because we have more than that. I think around 150 psychiatrists in the country currently practicing for our 45 or so million number of people. The only unfortunate part is most of them are in the urban centers, so we are really trying to have psychiatrists go into the, 47 counties in the country. So we are really working hard to ensure that every county has at least one psychiatrist so that they can be able to help our people back in the counties.
And then it would beg the question, so Kenya is doing better compared to those African countries. You're talking about 100 plus doctors for the millions of Kenyans who have mental issues. But how accessible are these medics to Kenyans who have mental issues?
So yes, accessibility is an issue. As I said, most people are, in the main urban centers. And so one of the ways that the ministry is also trying to come up with guidelines for telemedicine, so that at least you can have a way of contacting our patients or our clients, even if we're not having in person, like one-on-one. So we have guidelines in place. We are almost launching the guidelines for the telemedicine so that we can use that platform for service delivery as we try and bridge the gap, have more people do mental health related courses, have more people in the field so that we can have more people to help our patients. But for now, we are getting better. There's what you have and then there's what you hope for. And that's where we are today.
So when we talk about what we have and what we hope for in terms of health facilities, how are we doing as a country?
So we have the major, which is the Mathare National Teaching and Referral Hospital. That's where most of the patients are admitted currently. We have around, I think, 17 counties which have, out of the 47, which will have their mental health centers. Most of them do not have admitting centers, like admitting wards, but they have outpatient clinics. And now currently you also have focal persons for the 47 counties. So that means every county has a clinic for mental health, where you will be able to go in and the patients are seen. They have, at least they have clinical officer psychiatrists, they have clinical psychologists, so they're getting help. So the main issue is our referral system. We want them to be referred in the counties and not everybody coming to Mathare, and that's what we are working on. And also, as you know, Mathare now we are trying to have a bigger center, a better center, so that you can have people coming into the facilities and getting good care with everybody on board.
And you know, Dr. Makau, the reason as to why we're having this discussion about mental health in Africa, I just want us to narrow it down to the World Suicide Day, that is next week, this month. And you know, the World Suicide Prevention Day is observed actually every 10th of September each year to promote worldwide action to prevent suicide. As we celebrate this country, what are the statistics like for Kenya when it comes to suicide cases?
So I'm sure even you've been seeing in the media, it's really unfortunate, I think, with the pandemic, and also it's just sad that most people are now, they look like they're turning to dying by suicide as their mode of death. We are looking at every 4 people per day. And the DCI recently released a report that put Rift Valley as the highest, recording the highest numbers at 68. And then we had Nyanza coming in at number 2 at 67, and Nairobi was at 64, which is really sad that to see people are choosing to, die by suicide and instead of living. And it's a really sad reality that we are faced with, and we have to do something about it.
But then what are the telltale signs of someone wants to commit suicide?
A bunch of them. So we can start with hopelessness. This is someone who maybe was full of life from before, but all of a sudden they just speak like they just speak death. Like every time they express themselves, they're saying they want to die, or they feel like life is not for the living anymore. That's a warning sign right there. Or someone who maybe was not into alcohol use or substance use disorder, but currently they're just taking more and more. Instead of asking yourselves, most people judge, like, oh, these days this person drinks a lot. But in real sense, they're actually seeking for help, because that's one of the signs, not to drown their sorrows as a coping mechanism.
All right. Dr. I thank you for that. I just want us to have a look at the super walls again, and there's a reason as to why. And just to have a look at those super walls, because I need to put a connection between the mental issues and the issues of suicide. And there you have it again. We've talked about South Africa having 75% of people who are mentally ill who cannot access psychiatric care, and the National Health Insurance Program will not fully be implemented until 2025. A sad situation right there. But then when we comparing South Africa to Ghana, if I'm not wrong, it is about 10% of those people who have issues of mental health care. And it's only 10% who can, actually got it right. It's Ghana. No, Ghana, not 10%, but that was Nigeria. But Ghana passed its mental health law in 2008, and Ghana has 3 psychiatric hospitals. But comparing it with Kenya, at least we are doing better based on what Dr. Makawa said. Then Nigeria, yes, Nigeria is the one that had 10% less of mentally ill Nigerians. 10% of mentally ill Nigerians have access to psychiatrist or health worker. And when we look at some of the common mental triggers of mental issues in Africa, it is so sad that you may have a traumatic brain injury that can give you a mental health issue, childhood trauma, and this is something that I'll also be asking Dr. Makau just to explain to us about how childhood trauma can lead to a mental issue. What are some of these traumas? And then we have the genetic predisposition also right there being one of the causes for mental issues. And then violent crimes. And this violent crime is something that has also been talked about, and that is what also Dr. Makau mentioned, comparing it with Kenya, high cases of violence being reported in the Rift Valley region, bringing a lot of mental issues. And then also unemployment. I mean, you may be worried why you don't have a job. This can also lead to a mental health care issue, and also conflict. And anytime conflict is reported, you've also seen cases of where humanitarian aid organizations and different governments talking about psychological psychological advice, psychological counseling that ought to be given to people who have been affected by conflict. And Dr. the reason as to I was going through all that, and especially that part of the cause of mental health issues. So kindly connect it to us, childhood trauma, whether you've had a traumatic trauma, how this can, and conflict also, how this is actually tied very closely with the suicidal thoughts that probably someone can have.
So for trauma, you see, when you go through trauma, it stays in your brain. We usually say we treat the physical injuries, but nobody actually treats the mental injuries, where you find many times you think about it, you have flashbacks. You ask yourself why you went through the trauma. Especially in our country, we've not had like violence in terms of fights and war in our country. But for the people who've experienced it, there's just a trauma of reliving what you went through. Mm-hmm. Maybe you lost a limb, or you've even lost your relatives, you're the only sole survivor. Then you go to a different country, you don't have access to work in that country. You used to do well for yourself, but here you are begging. So that actually just changes your life. And for that, you can't pinpoint it. Everybody's like, thank God you're alive, but you don't feel it. In your heart, you're sad. Mm-hmm. You want more for yourself, but this is the situation you're in. Like in the situation for the refugees you are seeing in Uganda, you ask yourself, is it really worth it? Mm-hmm. And that's how you find ourselves depressed. And the patients now, because most of the patients who are seen to die by suicide have depression or anxiety disorders or other mental conditions that actually seems hard to cope with the normal stresses of life. Mm-hmm. Yes.
So Doc, when you look at some of the domestic violence that we've been seeing in the society, mm-hmm. can we connect that to mental issues? Because at the same time, you'll see a couple, one taking away the life of the spouse. Then at the end of the day, at the end of that incident, we also reported that the other partner decided to take his or her own life.
Mm-hmm. Yes. So you see, there's a lot of expectations. Let's talk about the COVID-19 pandemic that came. There's a lot of expectations on how people should react. Though, if you look closely, most people lost their jobs, so the financial instability is high. And most of the times, the financial instability brings unbalance, a sort of imbalance between the couples. Mm-hmm. And now, instead of sitting down and talking, because our culture does not really encourage sitting down and talking nowadays. We have people who just do things by whims. You don't have anyone to consult. You don't have anyone to talk to. There's no one to listen to you and your problems. So the more somebody thinks about their own issues and not getting a solution, then they decide, they get angry. They're easily irritated, they're easily aggravated, and something really small that could have been sorted mm-hmm. ends up into a big argument. Right. And now we are seeing increases in domestic violence, increase in abuses even in children, and it's just how we are handling our stressors. We're not handling our stressors correctly.
All right. And I like the fact that you're the technical assistant of the Presidential Advisor on Mental Health. Mm-hmm. So next week, Kenya is joining the rest of the world in celebrating the Suicide Day. Mm-hmm. When we look at our numbers, mm-hmm. In terms of suicide, how are we doing as a country, and what is the government doing to mm-hmm. ensure that cases of suicide are not reported in the society? And what is also the role of the society in mm-hmm. curbing suicide cases?
Yes, so the government, of course, has taken note of this. And as I said earlier, we have the suicide prevention strategy, which has listed a number of things that we're supposed to do. Number one, we are looking at the guidelines for telemedicine, so that instead of coming all the way to Nairobi, you can access healthcare, mental health care, directly on your phones, because as you know, Kenya has a good penetration of the mobile phone technology, so we are able to access people. So the telemedicine is one of the ways that we are using. Mm-hmm. Two, we are working hand in hand with to have decriminalization of suicide, because currently they are saying committing suicide. It's not an offense, it's death by suicide. So we are really hoping and working with other agencies, stakeholders, to decriminalize suicide. We're also doing another thing for sensitization of the media. We even have talks, and we're having a webinar on that, just how we report, so that we can use the correct terms. Mm-hmm. And even as a society, we want to be able to reach the communities. So we're working with the county governments to have implementation of the action plan, of the suicide prevention strategy, so that we can have the communities down there. We have community health workers checking on each and every one of us. And also as individuals, we're saying reach out. Talk to one another. Talk to people, have a buddy system at work. Because if you talk to one another, give a good environment where people can freely talk, we will reduce the stigma that is associated with suicide. And then now we are able to cope with our stresses correctly.
All right. Dr. Priscilla Macau, I like the way you've just wound up this conversation. We need to have an open conversation even at workplaces as a way of trying to get rid of suicidal thoughts. She is the technical assistant of the Presidential Advisor on Mental Health here in the country. Daktari, thank you for joining us here on Bottomline Africa. I know we will need you next time on this discussion as the country joins the rest of the world next week to celebrate the World Suicide Day, even as we try to lower the numbers here in the country. My name is Brenda Zederadito. Thank you so much for watching.